Hello, my name is JC Saldana, and today we're going to be doing some different techniques on some postural drainage, diaphragmatic breathing, pursed lip breathing, assisted coughing, airway clearance, and we're going to be using some breathing techniques using our upper extremities. JC, I'm just going to place you in a couple different positions today to help get some of that mucus and that gunk out of your lungs. Does that sound okay with you?
Yes.
Okay. So we're going to go ahead and get started, and our first position will be our postural drainage position. So I have my patient JC set up in the position to drain her lower lobe sections. So we've got 2 pillows under the hips, and we're just going to do our percussion and vibration techniques that we learned last semester to help her breathe, okay? So what I want you to do is just take your normal breaths, and I'm just going to add some pressure, some light clapping on your back, okay?
All right.
Just go ahead. And I'm really focusing my percussion on her middle scapula and the lower tip of her scapula as well. So after we have performed percussion for 3 to 5 minutes, we're going to then instruct our patient to take about 5 to 7 deep breaths, keeping our hands in the same placement and just vibrating at the same time, okay? So I want you to breathe in nice and big for me and breathe out. And we're going to do that about 5 to 7 times. So go again. Out. Now that we've finished with our vibration, on our last breath of our vibration, we want to instruct our patient how to huff. Do you remember what our huff sounds like?
Just breathing out. Okay.
Good. Sounds kind of like a ha ha ha.
Yes. All
right, you ready? Turn your head to your right, and I want you to breathe in good and deep, and breathe out and go ha. Okay, so we've got our patient positioned in a comfortable position, and we're going to teach them how to breathe using their diaphragm. So the diaphragm is located right underneath here, lower than the xiphoid, in between the 2 ribs. So I want you to try to push your stomach or diaphragm into my hand to try to breathe. Okay, do that a couple times for me. Good. Now I want you to place your hand under mine and see if you can feel it as well. Very good. Very good. If your patient is having trouble focusing on where their diaphragm is, you could place their hand out to the side and use some tactile cues to help them breathe in. So on the inhale, push it into my hand. And on the exhale, apply a little bit of pressure to help facilitate that breath. In. Very good. Out. Apply that pressure. This is now pursed lip breathing, and this can be performed supine or sitting, however your patient's most comfortable. So we have Miss JC here in supine. So today I'm going to teach you how to do some pursed lip breathing. So we have a little saying, and it's called smell the roses. So breathe in deep and make the candle flame dance. So go out of your mouth, just real slow. Very good. Gonna breathe in, real good and slow. Perfect. And what we don't want you to do is we don't want you to go how you would blow out a candle, okay? So we just want to breathe in slow, smell the roses, make the candle flame dance. Perfect. Okay, so now we're on to our airway clearance portion of today's video, and I'm just going to teach JC here how to do the correct technique on how to clear her airway using some other tips and tricks that we learned earlier in the video. Okay, so I just want you to breathe normally to you for 10 seconds. Good. Nice and slow. Just one more breath for me. Okay. Now I want you to breathe in using that chest, nice big breath for me. I want you to do 4 of those. So that's 1. Very good. Last one. Good. Now I want you to return to our normal breathing for 10 seconds again. Now back to that chest expansion one. Get nice and big and tall for me. 4 of those. So that's 1. Last one. And on this last breath out, I want you to turn your head and huff for me 1 to 2 times. Good. Do it again. See how that's coming up a little bit? Very good. Now just return to your normal. Okay. So now we're going to be teaching JC how to use her upper extremities to help her breathe a little bit better. So we're gonna have her in supine first, and then we'll do a position in sitting as well. So with supine, what I want you to do is have your thumb up to the sky beside your head. Yes, perfect. And on inhale, I want you to bring those arms up real big. And then exhale, bring them back down. Good. I want you to do that just 2 more times for me. Breathe in. Good. 1 more time. Okay, so for this one, it's the same thing. We're gonna go up on our inhale and down on our exhale, except for we're gonna have our arms like our butterfly wings.
Okay.
So we're gonna go up and wide on our inhale and down and then a little crunch on our exhale. Good. Very good. Good, how's that feeling? Good?
Good.
1 more for me. Very good. Okay, so now we're on to our last portion of today's video, and we are going to help our patient cough. So we're gonna have them take in 4 really deep breaths, and on the 4th breath, we're gonna have them turn their head, and on the exhale, we're going to increase that pressure by pressing down on the rib cage and helping them cough. Okay, so go ahead and take deep breaths in for me. So that's 1, 2, very good. 3rd, I'm gonna place my hands on you, so breathe in and turn your head for this last one. And now we're gonna cough. Very good.